Morning, friends. I'm Dr. K.R.K. Prabhakaramurthy, submitting you some case reports, very important case reports in my practice. All the cases, most of the cases are selected on the characteristic symptoms or PQRS symptoms very nicely, and it is easy to understand also. On that connection, I would like to narrate a case of a 48-year-old person who was suffering from psoriasis diffusa. Psoriasis diffusa is the only condition wherein the psoriasis patches are not dry. They ooze abundantly, and he was reportedly suffering from about a few years, and more severely for the last 1 year, 1 month, and having a treatment, homeopathic treatment only, at some efficient doctor in our Vijayawada. But he could not get any relief, and he was spending sleepless nights, and he is going to almost every day to the doctor, and he is giving him assurance that is the minor aggravation that will go out, don't worry, it will aggravate first and relieve later. Like that, the patient is spending sleepless nights and worrying a lot. After about 1 month or 1.5 months of treatment, the doctor, the senior doctor, told him to have some allopathic treatment first to subside it, later we will see. And this patient had a great quarrel with him, and is this the way you have to treat me? And you have taken 1 month time to suggest this. Like this, I will die in homeopathy, but not like this. And he came out and tried to file a suit also on him. At that situation, this patient's brother, who is an ardent follower of me, has taken me to his house. It is in the 3rd floor of the 4 floors apartment. The only staircases only available at the time. This has happened sometime in 1994. And I went up the stairs with little difficulty. I sat with them from 1 o'clock in the afternoon to 2 o'clock. For about 1 hour I was there observing the patient. The patient is very, very anxious, and the wife is also supporting, and 2 other relatives with families have also come there. As the patient is worrying a lot, not worrying, and he is confusing with anxiety and all these things. I observed only 4 points in this case. The patient is very, very anxious. In his face it is appearing, and he is taking many sips of water very frequently. In the 1 hour of time I have sat there, he has taken about 60 sips of water, and his anxiety is very much, and the oozing of this psoriatic area is very much, and the people used to cover him with a cloth and wash it in the soap or surf. Like that, this thing is happening daily for about 5 to 6 times a day. Like that, the oozing of serum is there, and the psoriasis diffusa is like that only. I observed only 4 points in that case. He is very, very anxious. The water taking frequent sips of small quantities of water, and his fear of death, and he also tried to jump out from the 3rd floor, as he is feeling very guilty. He used to wear only white shirts, white pants. Some people used to call him as Tinopal, like that also he told me. And at that juncture, how can I wear the dresses? How can I show my face to all others? These 4 points have come to my mind. This frequent sipping of water, and his anxiety, and the fear of death, and trial for this jumping from the upper floor, and also his gold-headed cane type of appearance, white dress, white this thing. I told him very firmly, you have also taken homeopathic treatment for the last 1 month or 1.5 months. I will give only medicine for only 1 week. If it is subsided, okay. Otherwise, you may have to go to a efficient dermatologist, which whom I will suggest. With that assurance only, he started the medicine, and after coming to my clinic by about 3 o'clock, I gave the medicine, arsenicum album. All of you know this is the gold-headed cane patient, and frequent sips of water, anxiety, fear of death, and suicidal tendency. All these things led me to give him this arsenicol. That was given 31 dose, dry on tongue, and later I asked another dose of arsenicol 30 to mix in half glass of lukewarm water, and let it be given once in half an hour, anti-clockwise, 10 to 15 times stirring, and 1 spoon once in 30 minutes. Like that, I said him, if the improvement comes, we will see within 1 week. Otherwise, we may have to go to the skin doctor whom I suggest. Yes, 1 day is passed. The next morning when I went to open my clinic, the relatives, about 4 relatives of him are at my clinic doorstep, told me, we are very, very thankful. He is having no sleep for the last 15 to 20 days, and after giving this medicine, the patient went into deep slumber from 4:30 onwards, and woke up at about 10 o'clock and had some rounds of coffee or tea, and when he slept once again, and he has not woken up. And these relatives thanked me very much, and they are going on the way to thank Goddess Durga for his recovery. Yet that situation, okay, I told, and within 15 minutes or so, the wife of this gentleman came to my clinic hurriedly and told, the patient has woken up from sleep, and he is making a lot of hurry-burry. You please come down, sir, come down, sir. Yes, immediately I went to the house of them, and saw that he is worrying a lot. I went with a opinion, yes, I shall send him to the dermatologist immediately. We may not treat. Yes, after observing some things on his body, the psoriasis patches are always round or oval like that. In these conditions, as I observed, in the center point of every circle, about 1 rupee or 2 rupees coin sized dry skin which has dried up. The Herring's law of cure has come to my mind. This process of recovery is coming from center to periphery, and there is nothing to worry. I became stubborn and gave him the assurance that you stand by this medicine, you will recover. But what about this trembling and all this? I am getting shivering and all these things. Yes, this is all because of the serous drainage all over the body. The calcium must have been down. You must be, if you have gone to other doctors, they will give calcium injections. I suggest you to take sufficient calcium in the shape of milk. I asked him to take 1.5 liter of milk daily, other than food. Even if you do not take rice or anything, you have to take 1.5 liters of warm milk. or hot milk. He accepted. The patient was given immediately one glass of hot milk, and the shivering everything has subsided. In the hurry, I have also asked that woman to give me some coffee, and I have also taken some coffee. And after about 15 minutes or 20 minutes, the shivering everything is subsided, and I gave him the assurance, I will send you to your office within 10 days of definitely the recovery will come definitely, and you will go to your office. He thanked me very much, and within 5 days he has come to my clinic. Within 5 days the skin everything has dried up, and he has worn the white pants and white shirts and came very happily within 5 days. And I assured him, I will go, you can go to the office within in the first week of December also. Okay sir, I will go. And in the first week of December on 1st, and within 10 days of this starting the treatment, he has started going to the office very much, and he is very very happy, and he thanked me very much, and his family members and everything, and he thanked me profusely. But I told him, this is cures of psoriasis. This is only this is one of the incurable diseases as suggested in the Drugs and Cosmetics Act. We should not assure you that this condition is completely cured, and if it does not recur with even after 5 years, it is to be taken as only cure. He told me, yes sir, I know, I am experiencing this since so many years, I know all these things, yet you have given me the life, rebirth. So I wanted to give you 1/3 of my salary to my as fees to you as a. Yes, I sincerely and I happily accepted it. Even though my fees is about 200, he gave me about 1/3 of his salary, about 3,000 rupees or so. That is the different story. And in January, once again, he was called to this head office at Chandigarh. As I wanted to go to Chandigarh, sir. It is relatively very cold place in January. How can you go? It may rupture once again. And I have given him some assurance and a few doses of arsenic alb also, and sent him. I suggested him to go in the air-conditioned compartment only. Why? Because the cold wave is very much in Delhi and Chandigarh. In such areas, you will accustom to these cold conditions in the air, this AC compartment only, and you can easily accustom. After returning, he told me there are no such relapses and no problem with the condition. He continued to be well. He was in my treatment for 2 years and went to Madras and transfer, and all these things have happened. And after about 5 years, when he came, he is normal, no doubt. And at that time, I am having the camera also. I have taken the pictures as the condition has not recurred from 1994 onwards. I have presented the case and the slides also in one of our conferences held in Hyderabad in 95 February. These are some of the photos taken after when he came after so many years. This is the right hand, completely very clean, and this is the left hand, another one completely clean. This is the back, where no symptom of any this thing is there. And this is the picture of the chest and abdomen, where there is no glimpses of any eruption. And these are the left leg completely very clean. And this is the picture of right leg taken very completely clean. This is one of the top 10 cases I rate it in my successful career of homeopathic practice. And with these few tips, I would like to take leave of you. The conclusion is, the observation is very much important. As I observed, this frequent sipping of his water is key to this case. His tinopal-like appearance and his present appearance in the diseased condition, where he was suffering from the skin eruption all over the body with oozing, and he is guilty, and it has driven him to fear of death and even a suicidal attempt also. And these are the conditions we have to observe very keenly, and if we keenly observe and treat them with the useful remedies, that will be very essential. That is very essential for the patient, for us to get succeeded in the cases. Thank you very much. Next time we will come up with another problem like that. Thank you very much.